Welcome to the Allen's Training Workbook video series. This video is a brief outline of Topic 4, Trauma. For further information and diagrams, please review the corresponding PDF document available on our website. Abdominal injuries. The abdominal cavity contains solid organs like the liver and the spleen, and hollow organs. Abdominal injuries could be caused by blunt trauma, penetrating injuries or illnesses, and infection. A person with an abdominal injury may also have internal injuries. They may feel sick and could possibly go into shock. Abdominal problems due to illness will cause site-specific pain and possibly a fever. In these cases, you should check responses, assess for shock, call an ambulance and monitor until the ambulance arrives. If a trauma injury has caused the internal organs to protrude outside the abdominal wall, they must not be pushed back in. Doing so will only cause greater complications. They are to be covered with a moist, sterile dressing that will not stick or plastic wrap. Bleeding. The human body requires the correct amount of blood and fluid to be transported around the body in order to function properly. The blood transports oxygen to every cell in the body and then transports the waste products away from the cell. Internal bleeding may be difficult to recognise, but should always be suspected where there are symptoms and the signs of shock. Internal bleeding can result from trauma or occur spontaneously resulting from disease. There are two types of internal bleeding, visible and non-visible. Visible. The most common type of visible internal bleeding is a bruise, when blood from the damaged blood vessels leak into the surrounding skin. Some types of internal injury can cause visible bleeding from a body opening such as the head or lung injuries. Non-visible. It is important to remember that an injured person may be bleeding internally even if you can't see any blood. An internal injury can sometimes cause bleeding that remains contained within the body. In these cases, you should seek medical attention immediately. Check response, conduct a verbal survey, and listen carefully to what the person tells you about their injury. Lay them down and keep them still. Types of external bleeding include abrasion and laceration caused by sharp objects slicing into the skin. There are three main types of bleeding: capillary bleeding, venous bleeding, and arterial bleeding. Open wounds are prone to infection. Always wash your hands and use gloves and follow standard precautions. Avoid breathing or coughing over the wound. First aid of minor bleeding would include clean with a non-fibre shredding material or sterile gauze soaked in normal saline or clean water. Apply antiseptic, cover with a non-stick sterile dressing such as a Band-Aid or a non-adhesive dressing. Change the dressing according to the manufacturer's instructions. For major bleeding, lay the casualty down, restrict movement and reassure. Raise the injured area above the level of the casualty's heart if possible. Instruct the casualty to place pressure directly on their wounds if they are able to do so you can get the padding, dressing and bandage ready. Apply a pad over the wound and secure it firmly with a bandage. Nosebleeds. Sit the casualty upright. Ask them to tilt their head forward to avoid blood flowing down the throat. Using the thumb and forefinger, ask the casualty to squeeze the nostrils shut, applying direct pressure over the soft part of the nostril below the bridge of the nose. Remain seated and hold for at least 10 minutes. Release the hold gently and check for bleeding. If the bleeding has stopped, avoid blowing your nose or picking at it for the rest of the day. If bleeding does not stop after 20 minutes, seek medical assistance.